Well, this week, the Desert AIDS Project changed its name to DAP Health. And along with the new name comes a new logo, branding campaign, and additional healthcare offerings to patients. I spoke with the Director of Brand Marketing, Stephen Henke. Stephen, it's great to see you again. Thanks for joining us.
Hi, Peter. Great to be here.
First off, tell us about the rebrand from Desert AIDS Project to DAP Health.
Yeah, it's been a long time coming. And, we probably started dreaming about doing this about 10 years ago. But in the last year, we really kicked off a process of listening. We asked a lot of questions for the community. We talked to literally thousands of individuals, our donors, our patients, our clients, our community partners, and we really just asked them, what do they want to see us do in the future? And they came back with two really clear messages. The first was that it was time to update our name to better reflect the scope of work that we do and the services we offer in the community. But the other thing we heard really clearly was our history, our 36-year history as DAP is a really important part of how people view this community. It's a place of great pride for them. And so they asked us, how can you move forward but honor the legacy of the men and women who came before, who did the work, and who brought you to this place? And so what you see behind me, DAP Health, is the evolution of that story as we move into the future.
And you're also expanding some of your programs.
We are. The COVID pandemic has shined a really bright spotlight on healthcare inequities in our world, but particularly in this community. We have a lot of folks in the Coachella Valley who live at or below the poverty line, and access to healthcare has never been more important. And so DAP is going to be doubling its ability to provide mental health care services. In fact, those clinics are under construction now, but we're looking at new ways that we can reach into underserved communities and make sure they get access to the care they need. And that's included during the pandemic, telehealth, virtual visits, mailing HIV tests to people's homes if they didn't feel comfortable coming into the clinics, and so many other ways that we're reaching into the community.
I'm curious, what has the reaction been to not having the word AIDS in your name?
The best reaction came from two of our founders who we spoke to as part of this process, and they were so happy that we were able to honor the history by keeping DAP. But they understood clearly, DAP started as a response to healthcare inequities, and it continues to do that work. It continues to serve underserved communities. And they told us that this name change will help us reach new communities in a more effective way. And they're really happy with what they've seen.
Before we let you go, Stephen, does DAP Health have a reaction to President Biden now lifting the transgender military ban?
Yeah, we serve the transgender community in healthcare, and we have done a lot of work to make sure that there are no barriers or roadblocks to access to care at DAP Health. Anything that the community or the leader of this country does to remove additional roadblocks to full equality is greatly celebrated by DAP Health.
All right, Stephen, we appreciate your time. As always, good to see you. Thanks for joining us.
Thanks, Peter.